Welcome to today's video, where we delve into the rare but fascinating world of bladder hemangiomas. These benign growths within the bladder can sometimes cause discomfort and complications. We'll explore what they are, why they form, and how they're managed. Join us as we shed light on this uncommon condition. The exact cause of bladder hemangiomas is still not fully understood, but there are some prevailing theories. Most experts believe they're congenital, meaning they're present at birth, though they may not be diagnosed until later in life. They are considered vascular malformations rather than true tumors. Genetic predisposition might also play a role, though specific genes haven't been definitively identified. Some research suggests that hormonal influences or certain growth factors could potentially contribute to their development, but these remain areas of active investigation. A bladder hemangioma is essentially a collection of abnormally formed blood vessels within the bladder wall. These vessels are often fragile and prone to bleeding. The location and size of the hemangioma dictate the extent of its impact. Small lesions might remain asymptomatic for years. Larger hemangiomas, however, can disrupt the bladder's normal function, leading to symptoms. The abnormal blood vessels can cause localized inflammation and irritation, further contributing to the clinical presentation. Bleeding from these abnormal vessels is the primary cause of the observed symptoms. Bladder hemangiomas are considered rare, with very few cases reported in the medical literature. Due to the lack of comprehensive data, precise epidemiological information is difficult to obtain. They appear to occur equally in men and women. While they can occur at any age, they are more frequently diagnosed in children and young adults. Because many cases are asymptomatic, the true prevalence might be underestimated. The signs and symptoms of bladder hemangiomas vary depending on their size, location, and the extent of bleeding. The most common symptom is hematuria, or blood in the urine. This can range from microscopic hematuria, only detectable through lab tests, to gross hematuria, where the urine appears visibly red or pink. Other potential symptoms include urinary frequency, urgency, painful urination, dysuria, and in rare cases, urinary retention if the hemangioma is large enough to obstruct the bladder outlet. Some individuals may experience flank pain if blood clots form and block the ureters, the tubes connecting the kidneys to the bladder. Many individuals remain asymptomatic for a prolonged period. Diagnosing bladder hemangiomas typically involves a combination of medical history, physical examination, and various diagnostic tests. Urinalysis is essential to detect blood in the urine. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and any abnormal growths. Imaging studies such as CT scans or MRIs of the abdomen and pelvis can help determine the size and location of the hemangioma and rule out other potential causes of bleeding. Sometimes, a biopsy may be taken during cystoscopy to confirm the diagnosis and exclude malignancy. While there aren't rigidly defined classifications for bladder hemangiomas, they can be broadly categorized based on their size, location, and number. They can be solitary or multiple. They can also be categorized based on their microscopic appearance, such as capillary, cavernous, or arteriovenous hemangiomas. The specific type does not dramatically alter the management approach, but knowing the subtype can provide additional information. The treatment and management of bladder hemangiomas depend on the severity of symptoms and the size and location of the lesion. Asymptomatic, small hemangiomas may only require observation and periodic monitoring with cystoscopy and urinalysis. For symptomatic hemangiomas, treatment options include transurethral resection, TUR, where the hemangioma is surgically removed through the urethra. Laser ablation can also be used to destroy the abnormal blood vessels. In rare cases, if the hemangioma is large or located in a difficult-to-reach area, partial cystectomy or surgical removal of part of the bladder may be necessary. Medications such as sclerosing agents may be injected into the hemangioma to shrink it. Embolization, a procedure where blood vessels supplying the hemangioma are blocked, is another treatment option. Unfortunately, there are no proven methods to prevent the development of bladder hemangiomas, especially given the suspected congenital nature of most cases. Maintaining a healthy lifestyle, including avoiding smoking and excessive alcohol consumption, may contribute to overall bladder health. But these measures are unlikely to prevent the formation of hemangiomas. Regular check-ups with a healthcare professional are recommended, particularly if you experience any urinary symptoms, such as blood in the urine. The prognosis for individuals with bladder hemangiomas is generally good, especially with timely diagnosis and appropriate treatment. Most hemangiomas are benign and can be successfully managed with conservative or surgical interventions. Recurrence is possible, so regular follow-up is essential. Recent research has focused on improving minimally invasive techniques for treating bladder hemangiomas, such as advanced laser technologies and novel sclerosing agents. Researchers are also exploring the potential role of molecular markers in predicting the behavior of these lesions. Future studies are needed to further understand the etiology and optimal management strategies for bladder hemangiomas.